Traveling across Kenya to visit some of the most remote dispensaries and hospital facilities in 10 counties, despite the sector's challenges of the times, this story is about Kenya Medical Supplies Authority, KEMSA, and its well-managed healthcare system that not only works but is progressively meeting the needs of the ordinary citizen to the last mile. Baragoi and Suguta Valley are home to the neighboring Samburu and Turkana communities, both sharing a county that is headquartered in Maralal, approximately 365 kilometers northwest of Nairobi. The commodities must reach beyond the risky clash-prone frontier if just to deliver on its promise to this ailing grandmother.
She's one of the few traditional women who understand what a hospital is or what a dispensary means or as a facility.
We're talking about 71 facilities being supplied by KEMSA. So you can imagine if we were to get the orders or the supplies from KEMSA in Nairobi, you bring them to the referral hospital, then you now start looking again for means to get them to all the facilities across the county. That would have been a headache, consuming a lot of time and causing unnecessary delays, whereas as we are ordering, the medicine are actually needed within the facilities.
With the new mechanisms put in place about KEMSA, we are a bit relieved.
Here in Wote, the deceptive beauty of the trees and bees of Makueni doesn't spare these young lads and lasses from the upsetting colon syndrome. According to the head teacher, Benjamin, this regular deworming exercise has been guaranteed by the constant supply of this commodity.
We are treating children against worms, and it's a good thing, yeah, because at home, children do not maybe get these services, but at school level, and now that you are here coming to schools, they're able to access these services very easily from officers from the Ministry of Health.
Ever since we began, we have steadily grown from simple storage handling to an innovative, fully fledged healthcare distribution service that can undertake the needs of all the 47 counties efficiently and effectively. In this competitive industry, our new business model today has allowed us to become your most reliable partner in healthcare. Our mandate is to offer a superior service, but not for profit. And our baseline principle remains affordable healthcare for all citizens. This is the motivating challenge that makes us get up very early every morning.
Among the many early risers, the proverbial beggar who sits on his golden stool claims these islanders as victims of their own tough choices. While malaria and HIV ravishes these fisher folk, the resident pharmacist here, responsible for 10 facilities on Fangano Island, can only expect that the delivery of medical commodities can be guaranteed.
The supply for the KEMSA US commodities has been good. Even at times when we make order, they always supply, even when the other essential drugs that are catered for by the county are not yet paid for. So in most cases, being that this one is a lake, and then there are mosquitoes around. So the USAID, they supply MRDT and antimalarials, those ones specifically for malaria. They also supply family planning.
Kennedy Odhiambo has learned to fend for himself by traversing these buoyant waters. And, like many of his compatriots, they dock from island to island, whether the day's catch bears little or much. What matters to Ken the most, he states, is the availability of commodities whenever he needs them.
Ya siku hizi kupata dawa imekuwa rahisi kilinganisha na kitambo. Kwa ajili saa zingine unapata kama mvuvi umeenda kwa lake, umekaa saa zingine siku kadhaa, pengine umepita hata siku yako ya kuchukua dawa, unaweza enda kwa clinic na uongee nao na atakuelewa dawa utapata kila siku kuna dawa, hakuna siku utaenda upate kwamba kuna dawa.
The journey that delivers these commodities by water also traversed many lands to get there. It shows the keen sense that KEMSA undertakes on getting to the very last mile, while keeping it real within the prudence of availability at an affordable cost and guaranteed quality. Trust in handling such sensitive commodities as methadone, only meant for rehabilitating addicts, have become the hallmark of a brand that is known to meet this high demand.
Sasa kwa watu wengi tunaingia katika hili janga tukiwa na ile expectation kuwa hii tunaweza control hii addiction hii. Unaona? That's the first thing unasema kwa mimi huyu kuvuta kwangu naweza control. Haiwezi nibeba hii heroin. Hiyo ndio kitu watu wengi wanatia mistake nayo.
An idle mind will always do something bizarre that you wouldn't believe. I mean, people who go to church sometimes backslide. So, how about somebody who was on drugs? You have all the temptation all around. So it's working in continuity as a society. I think this is what is key. And making sure that these are people who will be living examples. I've been talking of this lady who always in all the meetings would really testify how life was that bad. You would shed tears when they speak to you. And you realize these are the same people who will talk to their peers and let them see the focus. But in the end, you don't just leave them like that. If you leave them like that, they will relapse.
The good thing is, after methadone ilipokuja, kwa sababu watu walienda kujaribu kwenda kwa marehab, lakini watu wakienda kwa rehab, wanaregea to the same system, wanaregea the same tar, so they relapse.
Looking at the systems that we put in place together with KEMSA of understanding the reorder levels, I think this is what is critical. Because we know for one is that a client should never miss.
Nikaanzishwa dawa on February 24th ndo nimeanza methadone. Na I've never looked back since that day.
Besides Kilifi, Kwale County, separated only by the ferry from Mombasa, was vastly marginalized before devolution, but deserving of all attention in medical supplies.
Actually, we are grateful to KEMSA for actually availing these commodities to this facility, as far as even going to the rural health facilities.
Before devolution, when we used to be in this county, people would stay in their houses until they see the KEMSA drug coming. Then everybody, the facility would be full. They'd come because they know drugs have come. They'd stay for months without drugs, and they only see the vehicle coming, named KEMSA, then they'd rush to the facility because they know now we can get drugs.
This is a pull system now, unlike before, whereby I think KEMSA used to push. So like now, that's why I don't have any commodities that I can say I have this in excess or I have to distribute to other centers. You know, what I have is enough for the hospital and the community.
So the beauty about this is that the facility themselves at the lowest level order what they need, and at our level we consolidate what the county needs and we order from KEMSA based on the funds that we've been given. And the beauty about this is that when KEMSA delivers the drugs, if they don't deliver a drug, we pay them less than what we have. So it is demand driven, and it's very transparent.
And to Lamu, at the other extreme end of Kenya's coastline, Nurse Esther reports that she's neither lacked nor wanted in delicate supplies for both mother and child.
I can say more people are coming to the hospital because there are drugs. Initially, before the devolution, they used to come, then the mother is seen or a patient is seen, you're prescribed for a drug and you're told to go buy this. But right now, we have all the drugs. Like even with the free maternity services, they're so happy. They come, like hematinics, those ones with anemias, we admit them, they get the blood, they get the hematinics, is there.
KEMSA has, KEMSA initially, the initial KEMSA that we used to know, even when I was working as a DMH, if you compare the number of products that they used to have those days, they had less than 20 products that they could bring to our hospital. The essential drugs plus some little other non-pharmaceuticals. But right now, the number of products that KEMSA is issuing is way over 250 different products. So it's not the KEMSA that we used to know. KEMSA is far much improved now.
KEMSA's bulk purchasing is a direct advantage to clients in all counties that transfers the lower cost benefit directly to the citizen. Appropriateness of documentation and the assurance of quality in the procurement process for all supplies to the Government of Kenya's Ministry of Health measures against KEMSA's commitment and dedication.
KEMSA, I can say the integrity is quite high. You are given time to source for your samples. You have to bring the correct samples. People say it's difficult to get business in KEMSA, but I can assure you, when you do your things right, and especially the documentation, you don't need to know anybody to do business in KEMSA.
Coupling well within the new business model of a revolving fund, this has kept the integrated supply chain circulating against the demand for most essential commodities. But the Logistical Management Information System, or LMIS, has quickly gained its stripes, where the integrity of the orders have hence originated, even from the farthest borders.
It starts with now me setting the booking period. Of course, we get the updated Excel order sheet from KEMSA, which is then provided to each of the in charges. That's one county, the second county does it, the third sub-county does it. Then now they come onto my portal. And by the time they're coming to me, the sub-county pharmacists have vetted and cleaned it. So now that's easier, because before I used to do it, it used to take me too long. But now with this LMIS, it's easier because they believe and I trust their competencies and they're good enough. So once it comes up, I just have a quick glance and I consolidate.
With the objectives that you have in KEMSA, bringing the right quality at the right cost, this LMIS system, it will help you to bring about the efficiency in terms of the deliveries at the right time and at the right place.
Medicines and medical supplies are also very important for healthcare delivery in a country. That is the availability of medicines and medical supplies, the quality of those products, as far as addressing the healthcare needs of the people are concerned. Today, in the name of the facility of KEMSA, we have a public entity with the capacity to supply this country effectively with quality and cost-effective medicines to all the parts of this country. And some of us who have come a long way alongside that initiative are even proud actually to be associated with that success.
The organizational commitment to deliver this service goes beyond the expectation to reach every citizen needing these commodities. This is why partnerships with each county is working wonders to guarantee the promise of availability, quality, and cost.
Yeah, the partnership with KEMSA is very key to us as a county. It's very important in terms of service delivery for us, because KEMSA supplies up to the doorstep of each and every facility, including the smallest dispensary and the newest dispensary. Neti inatusaidia kuzuia malaria, hiyo ugonjwa wa malaria. Pia inatufanya tukue wagonjwa, mbu ikikuja inakuwa nje. Tulianza na neti, alafu wakamaliza na hiyo, kama ukiwa na mtoto ni mzuri kunyonyesha for 6 months. Hiyo kunyonyesha inazuia ugonjwa.
KEMSA evolved in 2005 to a fully fledged agency, a parastatal, under the Ministry of Health. And now when that came, now we got funds from the ministry, and we got more employees, and we even got vehicles. Now that's the time I was even given a pickup where I could travel and go and supervise, besides the lorry.
15 years and counting. Dr. Dagane cut his teeth back home in Garissa County as one of KEMSA's longest-serving staff. He is a skilled pharmacist.
When a patient who is in Mandera or in Wajir gets supplies, and they get cured from their ailments, I get relieved. I feel happy. So when I call a facility and they have all the items that they need, then I feel that is what motivates me more.
Here, movement requires a tough vehicle or otherwise, relying on the trusted desert hoofs to get medical attention from this far-flung facility in Balambala.
There's a time she remembers, some time back, she had those, the eyes were closed, she has those infections in her eyes, and she was on the back of a camel. The only dispensary at that time was in Saka, the nearest division. So when she was being brought from taken from the family there, she came across an elephant. And the people were just running. She was fearing for herself to see she was making that. And now, where she is, that the drugs are coming to her immediately with before it has any infections or any disease takes over her. The drugs reach immediately. She goes to the hospital. She gets the drugs.
The counties have built a lot of dispensaries, a lot of facilities. And now they're increasing. We used to serve 30 facilities, now we are serving 100 facilities in Garissa.
So lastly, but definitely not the least, greeted by the chill of Marsabit's thirsty breeze, this is a county that knows all too well the contrasts of nature's irony. Several partners concerned with Marsabit's children and mothers alike plan for regular outreach activations as far as South Hor and Chalpi Desert, where KEMSA must reach.
So every year, even when there's not a drought, we still have to reach about 60,000 severely malnourished children across Kenya. So and that's a lot of commodities. And they're bulky, and for smaller health facilities in faraway areas, they don't necessarily have the room to store large quantities. So having a dynamic, flexible system like that KEMSA provides with monthly dispatch is a really important factor, because it means that smaller amounts can be brought to the facilities that are manageable, as opposed to our previous model where we used to distribute quarterly.
Considering that many of our clients here in Kalacha Hospital, many of our target population comes from the hard-to-reach areas. You know, these are pastoralist communities. There are only few villages which can access health center from the town, but majority of them, as we go even inside the Chalbi Desert, all over there, all over the mountains, there in Huri Hills, far around 40, 50, 60, 70 kilometers, we go to reach them because it will take them really long time to come here.
Poverty reduction is our goal, and that is the goal of Kenyan government. With ensuring availability of essential medicines at the point of service delivery, KEMSA really contributed in achieving that goal. And this is probably one of the most successful models we have in public sector in the region and probably globally.
We see KEMSA actually becoming the leader. And we also see KEMSA being able to possibly go even beyond Kenya in terms of providing services, both either technical assistance to the other countries who are unable to do their own procurement, supporting them to be able to come to the status of KEMSA as well, but also helping them to sort of procure. Because I strongly believe that in Africa, if we can work together and do joint procurements, we could actually be able to get economies of scale better and get better prices. We would get the prices even getting lower, as we move forward. So I think KEMSA will take the lead in that. That's the future I'm looking at.
With most of their prayers now answered, KEMSA's one-stop shop begets its reputation in the corporate mandate, from procuring to warehousing and subsequently supplying the medical commodities to the last mile.